In the United States, roughly 40,000 people get diagnosed with type 1 diabetes. This is a form of diabetes where the pancreas do not produce any insulin. Insulin is a hormone the pancreas releases to assist in metabolizing glucose. By releasing insulin, our bodies are using homeostasis to prevent hyperglycemia, or an excess of glucose in the blood. When our bodies become hyperglycemic, we develop ketoacidosis, a condition where the body stops relying on glucose for energy and starts relying on ketones that are built up in the blood, which can eventually lead to diabetic coma or death. From March 2, 2007 until December 21, 2015, a study was performed to determine if taking insulin orally will help prevent type 1 diabetes in relatives. The trial was divided into two different stratums, with the second stratum divided into substrata. These groups had their relative risk for the onset of diabetes estimated, and the critical value for the test statistic was calculated to be 0.047. Beginning with the primary stratum, eligible participants had to show positive for islet cell autoantibodies on two different samples. Subjects also must have taken an intravenous glucose tolerance test and have a first-phase insulin release higher than the threshold. For participants aged 3 to 7, the threshold was 60 microunits per milliliter, and for siblings and offspring aged 8 to 45, or other relatives aged 8 to 20, it was 100 microunits per milliliter. Secondary stratum 1 is almost identical to the primary stratum, except for the fact that the first phase insulin release had to be lower than the threshold. For secondary stratum 2, islet cell autoantibodies were not confirmed, and the first phase insulin release had to be higher than the thresholds. Secondary stratum 3 is identical to secondary stratum 2, except for the first phase insulin release had to be lower than the threshold. Since this was a double-blind study, the randomization process was not randomized based off stratum. Everyone either received a capsule of insulin or a placebo. These capsules were to be taken daily for the duration of the study, and the subjects had to visit doctors every 6 months to refill their capsules. The patients were followed up for a median of every 2.7 years, with an interquartile range of 1.5 to 4.6 years for the primary stratum. The participants in this study were related to people with type 1 diabetes, and they also had normal glucose tolerance at the beginning of the trial, although they tested positive for islet cell autoantibodies. The outcome of this study revealed that 120 out of 389 patients in the primary stratum were diagnosed with diabetes, 58 from the oral group and 62 from the placebo. Of 55 subjects that were in secondary stratum 1, 32 were diagnosed with diabetes. Secondary stratum 2 and 3 were combined into one since the sample size was too small for them to be measured separately. In these strata, diabetes was diagnosed in 11 subjects. Although use of oral insulin to prevent type 1 diabetes was not supported in this study, this trial emphasized the importance of identifying type 1 diabetes in its early stages. Individuals in this study with 2 or more antibodies and normal glucose tolerance are considered to have stage 1 type 1 diabetes. If no precautions are taken, this person will likely develop stage 2, which will progress further due to abnormal glucose levels. The average rate of progression of these stages in this study was 9.5% a year. Comparing the patients given the placebo against patients given the oral insulin dose, the development of type 1 diabetes was not delayed.